for, but you and I will chat about it, and I just really want to try and get into your head as much as possible, because the kind of surgery I do is really personal, and I want to principally understand you. I want to know what your motivations are, what you're hoping to get out of the surgery, what a good outcome feels like and looks like to you. And I really am, that's the point at which we're trying to work out, okay, what is the best treatment option for you? Am I the best person to deliver it? Can I deliver it? I hope I'm going to say yes to that, and I hope I'll be able to show you patients very similar to yourself who have had surgery recently, and their kind of outcomes. And I like to show you, you know, not just the sort of awesome outcomes, but actually just normal, ordinary outcomes, and actually a few complications too. So I like people just to really go into this with their eyes open, knowing what to expect, because the truth is, complications happen, but actually they're all things that can be dealt with and can be managed, and as long as you know and you're not stressed, it's actually not a concern. You just deal with it and it's fine and you move on. So we'll spend a lot of time talking about that. I will examine you, of course, and when I examine patients, there's a chaperone present, so there'll be one of the lovely ladies with us at the time. I get some photos of you, then I draw, mark, measure. I tell people they end up looking like a calculus board. It's kind of cool, because if you ever watch a kind of plastic surgery drama, kind of like Nip Tuck, and you see all the kind of stylized plastic surgeon drawings on patients, then that is really what it's kind of like. So we do all of that on you, and then I take photographs of those drawings. I may I may do a simulation. So there are some things that I can simulate on you, such as a breast lift. And if you're in for a breast lift, simulated breast lift with taping is the happiest I ever make a patient professionally. In my room, it's the most happy I can make a person, I think. So that's a simulated breast lift. Sometimes I do 3D simulations, and then that's it. I write you a letter recapping it all, so you don't need to write furious notes. Do write down questions in advance though, and feel free to reel them off. I do not mind at all. Send you loads of written information, send you quotes, and that's it. If you decide this is for you, then we meet a second time to really fine tune it. Make sure that you've understood everything. We talk about risks, potential complications, a lot of detail. It's a real heavy consultation for consent. And then that's it. Surgery goes ahead. So that's it.